patients are increasingly interested, what patients are telling us, that they're increasingly interested in knowing what the effects of treatment, or what they will look like, what they will feel like in years down the line. So obviously our research has to deliver that, and we're still working on that. But by working with our colleagues in computer science and in web development, you see an increasing number of apps being used in practice, but also still in trials, as has been presented at this conference and other trials. I think the use of one of the things that I think is very useful for patients is that they feel that they're personally supported in their treatment journey, and also they feel more informed. That's what they're telling us. It's part of the consent for treatment. They feel more informed about potential side effects or the potential effect of treatment on their bodies. Also, potentially the success of treatment, although it's not the subject of this app in this. And I think in the future we'll get more and more of these interventions as part of personalized medicine being driven forward. So I think clinicians are, although there is some, in terms of AI, there is some, traditionally there's been some mistrust of AI amongst clinicians. By having approaches such as the one we employed in the PREACT project, which is Explainable AI, that gives an explanation for the prediction. So by deriving propositional rules, for example, will help, and the risk factors that that patient's risk is contributing to their increased risk of will be displayed in the app. That will hopefully explain the patient why this prediction was made, and that will help inform, make the decision more trustworthy that they can take from the app.